So let's see everything that you need to know about the hepatitis B vaccine. So hepatitis B is a global public health problem. Approximately 1.5 million people get newly infected with hepatitis B every year. The common modes of transmission include the vertical transmission, which is from a mother to the baby, sexual transmission, needle stick injuries for healthcare workers and also for drug users, and infected close contacts by sharing objects like razors and toothbrushes, etc. So reports say that approximately 2 people die of hepatitis B every minute in the world, which is crazy. And that's what has led to the development of the hepatitis B vaccine. And we need to thank Dr. Bloomberg for it, who was the one who first identified the hepatitis B virus and also invented the first hepatitis B vaccine in as early as 1969, for which he also received a Nobel Prize. So let's look at the basics of the hepatitis B vaccine. It's a kill vaccine, so it's safe. What is the schedule of the hepatitis B vaccine? So the first dose has to be given within the first 24 hours of life. That's very important to prevent the perinatal transmission of hepatitis B from the mother to the baby. Now, the second and subsequent doses can be given at 6, 10, and 14 weeks along with the pentavalent vaccine. So the pentavalent vaccine has DPT, hepatitis B, and Hib. Okay, so instead of poking the child separately for different vaccines, the pentavalent is one poke, which has these five organisms getting covered in it. So the first dose has to be given within 24 hours of life, and then the second and subsequent dose of hepatitis B can be given as a combination of pentavalent at 6, 10, and 14 weeks. Now, let's say the child did not receive the complete schedule at in the infancy. So for older kids and even adults, again, you need to give 3 doses at 0, 1, and 6 months. We don't need boosters for hepatitis B because if you have completed the 3 vaccine course, it offers lifelong immunity. The dose is 0.5 ml in kids and 1 ml in adults more than 18 years of age. It has to be given intramuscular. Now, the two sites could either be the thigh in kids less than 3 years of age or the deltoid in slightly older kids and adults. Gluteal absorption of the hepatitis B vaccine is poor, and that's why that route should not be used. So, Hep B is always given either on the hand or on the thigh. Okay? Now, it has to be stored between 2 and 8 degrees Celsius. The vaccine should never be frozen. If in case accidentally the vaccine gets frozen, it should be discarded, should not be used. Okay, so this is the basics of hepatitis B. But what is most important is the vaccine in certain special scenarios. This is important from the clinical perspective, also from your exams, whether it's your Viva or MCQ. So what do you do when a mother is hepatitis B antigen positive? So first and foremost, all women should be tested for Hep B antigen at the very first prenatal visit, so you know exactly what the serology status is. And let's say the mother is hepatitis B positive. So what do you do then? The baby who's born to a hepatitis B positive mother should receive 2 things at birth and within the first 12 hours of life. So you have to give the first dose of the hepatitis B vaccine intramuscular and hepatitis B immunoglobulin, which is also 0.5 ml intramuscular. So both these things have to be given to a baby who's born to a hepatitis B positive mother at birth within the first 12 hours of life. You give the 2 different pokes at different sites, and irrespective of the birth weight of the baby, if the baby is born to a hepatitis B positive mother, these 2 things have to be given. Now, what about the subsequent doses? So subsequent doses depend upon the birth weight of the child. So let's say the baby's birth weight is more than 2 kgs. So then you give the second and third dose at 1 and 6 months respectively. But if the baby has a birth weight of less than 2 kgs, then you consider the first birth dose as like a 0 dose and give 3 other doses. So the baby with a birth weight of less than 2 kgs will require 3 additional doses at 1, 2, and 6 months of age. So most important point to remember here is what needs to be given to a baby who is born to a hepatitis B positive mother. So you need to give both the first dose of hepatitis B vaccine and hepatitis B immunoglobulin within the first 12 hours of life. And then the subsequent doses depends upon the birth rate of the child. Now, what are the adverse events and contraindications of the vaccine? So it's a pretty safe vaccine, so it can cause mild headache, myalgia, fever. There is no obvious specific contraindication to giving hepatitis B other than if there has been a hypersensitivity reaction to the previous doses. Because it's a kill vaccine, it's safe, and even pregnancy is not a contraindication for giving hepatitis B vaccine. Now let's look at one last interesting concept of post-vaccine serology. Okay, so usually if the child or if the patient is immunocompetent, then you do not have to do a serological assessment to see the antibody response to the hepatitis B vaccine. But even in immunocompetent children, there are certain scenarios when after giving the Hep B vaccine, you really have to assess whether they have produced the required amount of antibody or not. So three scenarios where either the mother was hepatitis B positive, or we do not know the hepatitis B antigen status of the mother. Let's say the child was abandoned and we don't have, don't have idea of who the mother was. Or the third scenario being mothers whose prenatal hepatitis B antigen status are not available at the time of delivery, but they do have some other evidence of Hep B, like chronic hepatitis B or Hep B DNA virus in their blood. So basically, there is some amount of infection in the mother. So these are the three scenarios where even if the child is immunocompetent, you have to do a post-vaccine serology to look at the antibody response to the Hep B vaccine. So in these kids, you will do a hepatitis B antigen and antibody assessment at 9 to 12 months of age, or 1 to 2 months after the third dose if the child has not received the complete dose in infancy. Okay, so let's say there was a delay in completion of the 3 doses of the Hep B vaccine. So in that case, 1 to 2 months after the third dose is where you check for their serology levels. So this was with respect to the immunocompetent children. Whereas on the other hand, if you have immunocompromised children, let's say those who are on long-term steroids or chemotherapy drugs, immunocompromised, in those patients or in those kids, you will do a hepatitis B antibody titer annually. And if the titer value is less than 10 milli international units per ml, that means their antibody response is inadequate. In those scenarios, you can give a Hep B booster dose to ensure protection against the virus. Okay, so this is about the Hep B, the basics, and what is most important to remember is what do you do when a baby is born to a mother who's hepatitis B positive. Just to end the discussion, 28th July every year is celebrated as the World Hepatitis Day in honor of celebrating the birthday of the Nobel Prize winning scientist Dr. Bloomberg, who not only discovered the hepatitis B antigen, but also invented the first Hep B vaccine. So that's the end of the discussion, and see you with another video on another vaccine soon. Thank you.